Well, thank you, Alan, and Robin and everyone who's come to our final week of sitting. If people sort of grab onto you as you're leaving the corridor, it's because we all get a bit desperate in here. We get sort of cabin fever, and just when there's a real person who comes into Parliament from the outside world, we just want you to tell us what it's like out there and just reassure us that there are still sort of people beyond the walls of Parliament House, because this last week of sitting just gets a little bit angsty, and they go for very long days and nights. I'm not going to acknowledge everyone in the room. You're all friends and well known to us who've been working in mental health for a long time. I do want to acknowledge Connie Fierravanti-Wells, the Shadow Minister for Mental Health, and thank her for attending today. I think on behalf of all of us, I do want to acknowledge Frank Quinlan, particularly that addition to his face between his lip and his nose. And on behalf of all of us, express the hope that it's temporary, Frank. And our admiration for your fundraising willingness, but really it should not be a permanent addition. This is a wonderful occasion, the release of this report card, and really having been able to do it so quickly, given that the Commission was only put in place in January, really is an extraordinary achievement by you, Alan, by Robin, and by the other commissioners and staff at the Commission in Sydney. But I thought I'd just give a bit of background about why we established the Commission and why we established the report card. As Alan, I think, implicitly alluded to, there was, as you know better than me, a very significant national debate around mental health services in 2010. For the first time, I think in a federal election campaign, mental health was a substantial topic of debate and contest between the alternative Prime Ministers. Both of the major parties took a significant agenda around mental health to that election campaign. And the preparation and delivery of an annual report card was a part of the offering that we gave to the people in that campaign. And there are a couple of reasons for that I just want to allude to. The first is that it struck us that there's no shortage of reports in mental health, but so many of them focus on the number of beds that we have in the hospital system, the number of doctors and the number of nurses, what I describe as inputs into the system, and very few of them, if any, that we could find, focus on the outcome, focus on the degree to which those services are delivering change in people's lives, or to use the language of the Commission, helping them to lead contributing lives in their community. That's really the first thing that we wanted. We wanted a reporting system that was squarely focused on the experience of consumers and their carers, and which tracked the capacity of our services to help those people lead contributing lives. The second thing we wanted to do, that Alan again alluded to, was to broaden this from just being a health systems report. Yes, we want to know how the clinical systems are supporting people to lead a contributing life, but we know that just important as those clinical services are, it's also important that people have access to stable housing, have a chance at a job, and a range of other things like that, just to name a couple. So having a broad cross-portfolio, cross-topic perspective, we thought was critically important. The third thing, though, that I think is really important is that, as Alan said, we don't see the focus, the community focus, the political focus on mental health drop off for another 4 years, and in 5 years things will get to a point where it has to come back on the public attention. What we wanted was the capacity to track year by year in a meaningful way how things were going. We wanted the capacity of an independent organisation like the Mental Health Commission to bring profile again to the issue of mental health in the way that Alan and Robin and others have been able to do today. We've seen extraordinary attention in a day where, frankly, there's a bit going on in this place, extraordinary attention again to whether or not our mental health services, clinical and non-clinical, are providing the support that we should expect be provided to Australians living with mental illness. So I think that this was a good idea that, frankly, has already in its first year made a difference. I really do want to pay tribute to the work of the Commission in 10 or 11 months to be able to come together and, I imagine, do your, forming and norming and storming, and to be able to put together a report that really is qualitatively very different to the other reports we get in this area is really, really important. I also want to pay tribute to the people who were willing to have their stories told either on film or in the report itself. I mean, one of the things that I found most captivating in reading this report was those one-page stories that many of you in the room were courageous enough to reduce to print. They were incredibly powerful, much more powerful than a long screed of statistics about hospital bed numbers and doctor numbers and such like. They really do give the best examples of the way in which a service system, well designed, focused on the needs of consumers and their carers, can actually make a difference in people's lives. I'm really looking forward to next year's report, but I thought before we get to next year's report I should probably say a few things about the recommendations in this year's report. I think what it does is to reinforce what I feel about things, which is that while we are doing a range of important things to expand and improve services in this area, there is still much to do. This is an area that will require long-term attention if we're going to get services to the point where they should be. It's not going to be a couple of years, it's going to be a number of years of focused effort and of focused reflection to make sure that what we're doing is working, and if it's not, we improve what we're doing. So the idea that we reflect on what we're doing well but recognise what we're not doing sufficiently, I think is something that the Commission should continue to articulate without fear or favour. I think, for example, the report reinforces the importance of the investment we're making in effective community-based responses to suicide risk. I think they're still in the process of being rolled out, but I think the central attention given in this report to the tragedy of suicide and the need to tailor responses around particular cohorts in the population reinforces what we are in the process of doing. But I think the report does urge us to do something we haven't done enough of, and that is to pay regard to the physical needs of people particularly living with severe mental illness, and really bringing attention to that substantial life expectancy gap, the 25-year life expectancy gap that is in the report, that really is just such a striking figure that all Australians should focus on. There are a range of other things I think that state governments need to focus on. It's 2005 when the then Howard government struck an agreement with state and territory governments designed for them to drive down rates of seclusion and restraint in their hospital system. And yet still, not all states and governments are telling us what they've done with the substantial funds that the Howard government and then our governments have given to state governments to assist them in doing that. And all state governments should be willing to report in a transparent fashion what exactly is happening around seclusion and restraint in their public hospital systems. They should also, frankly, redouble their effort, as the report says, on making sure that there are arrangements in place in those same hospitals that ensure that people who are being discharged from those hospitals, often with quite severe mental illness, still in a state of crisis, are not discharged into a situation of homelessness. This is not rocket science. This is again something that was included in our national partnership agreement between the Rudd government and the state governments around homelessness in 2008. And if you look around the country, there are a range of good examples of ways in which health officials and housing officials can cooperate in the emergency departments and in hospital settings to make sure that the discharge plans that are put in place actually look to questions of stable housing and things like that. So this is a really important report, I think. It does what as a minister you love, in the sense it really pushes the envelope, but doesn't do so to such a degree that people say, well, that's just not going to happen. It really does push us to make sure that we don't rest on the laurels that we as a government or we as a parliament have put together over the last few years in bringing attention to this issue, but that we continue to roll out that which we've promised to roll out, and we also look at some of the areas which perhaps haven't got the attention that they deserved over the last few years. For example, the physical health needs and the life expectancy issues associated particularly with psychosis and other severe mental illness. So thank you very much everyone for coming along. It's been, I think, a really impressive journey over the space of only 10 or 11 months to bring together some very powerful personal stories and extrapolating from those personal stories some important messages for governments, and for oppositions and for governments at a state level, I think, to continue us on this journey in Australia of making mental health supports and services for people what they should be. So thank you for coming to Canberra. I look forward to having a chat with you after.